Let's talk about what to do after you've had a heart attack. First things first, you're already a survivor, so pat yourself on the back. Now, let's pick ourselves up and figure out what we can do to keep this from happening again. You're in very good company because over 800,000 people a year in the United States have a heart attack. So, we know that we have much better survival rates than we did 20 and 30 years ago. My grandmother had a heart attack and had a bypass surgery, and within a year had clotted off all but one of her bypasses. We have better tools now to help keep that from happening, and so I want to share those with you. You're feeling overwhelmed, and it's pretty common for people to have depression in the months and weeks following a heart attack, so don't be afraid to reach out for help. You're probably busy juggling your other medicines and thinking you don't want to add something else in, but it's actually a pretty common thing to need to be treated for depression, whether it's medication or therapy. Don't be afraid to reach out. Also, you're probably taking a whole boatload of medicines now, probably 1 or 2 different kinds of blood pressure medicines. Those are to help keep your tissue healthy and to prolong life. And so those are some of the things that we really feel like everybody who's had a heart attack should be on. You may be on some sort of a blood thinner. You are probably going to be on cholesterol medication, and you may be taking it kicking and screaming. And you might say, hey, my cholesterol isn't that bad. But we also know that statin drugs can have other effects. They can help to regress or make plaques smaller, and they can help prevent plaque formation. So anything that we can do to help decrease your risk is a good thing. Nowadays, if the cardiologists can get someone into the cath lab to do a stent if they find the blockage, sometimes we can avoid heart bypass surgeries, which is huge. They sometimes use clot busters, but there are different things. You may have had some sort of a procedure during your stay, and if you did, again, you're a survivor. Let's pick up the pieces and move on. One of the things you probably heard talked about was your ejection fraction. That tells us the percentage, how well your heart is functioning. And 60 to 65% is great. And you probably heard that talked about after you had an echocardiogram or an ultrasound of your heart. Was there damage to the heart muscle or not? That can help tell us the extent of the heart attack that you had and can definitely influence which medicines you need to take. Did they find that you have a heart rhythm problem or an arrhythmia? Did they maybe give you a pacemaker while you were there? People sometimes get pacemakers, sometimes internal defibrillators. If there's a fatal arrhythmia going on, that can shock your heart right back into a good rhythm. One of the things they're going to emphasize is exercise. They might have started you in cardiac rehab, which is a program designed specially for heart patients to help improve your endurance and prolong your life. But if they didn't put you in cardiac rehab, start building that yourself. Of course, don't push yourself too hard, but studies show that people who exercise live longer. So even if it's something as easy as going out and taking a really slow walk at first, maybe just a walk to the mailbox and back, any activity is going to be good for you. If you were doing something active when you had your heart attack, then of course I would always caution you to talk to your doctor and ask what types of activities are okay for you. You're always going to want to make sure that you have your cell phone with you or some sort of a life alert button, something that can alert people if you've had a problem. Keep that phone with you. It could be a lifesaver too. People are always asking, is it okay if I do this activity or this activity? Most of the activities that you did before should be fine afterwards. And if you feel healthy enough for most activities, I would say go enjoy yourself. They've probably recommended some dietary changes for you. Increase your fiber intake. Watch your sodium intake. They may have even had you talk to a dietitian to set some actual numbers on that. Which is very helpful when they give you things that are written down. All those pamphlets and booklets they sent home with you, that's probably in there too. Watch your caffeine intake and your fats. Try to focus on lean meat. They will often advise avoiding red meats too. So talk to your doctor if you have any questions, but also they're going to tell you to avoid alcohol because alcohol can negatively affect your heart. So another addition if Dr. Mindy hates us and doesn't want us drinking alcohol, but limit your alcohol consumption and it will help your heart long term. What it really boils down to now is keep your appointments, stay involved with your medical team because they manage this regularly, and stay informed, ask questions, and you'll be a lot healthier now.